Imagine the heartbreak of a parent learning that their newborn's survival odds could be stacked against them simply based on the color of their skin. This isn't just a hypothetical scenario, it's the alarming truth uncovered by a groundbreaking study from the University of Liverpool, showing that babies born to black mothers face an 81% higher risk of death compared to those with white mothers. As we dive into this eye-opening research, you'll see why this issue demands our urgent attention and why it's time to confront the systemic barriers that persist in healthcare. But here's where it gets controversial. Could these disparities truly be erased just by tweaking medical practices, or do they point to deeper societal flaws that we, as a community, need to dismantle? Let's explore the details and unpack what this means for families everywhere. Building on recent revelations from organizations like the Royal College of Nursing and Age UK, which exposed ongoing racism and obstacles for nurses and patients of colour within the UK's National Health Service, NHS, this new report sheds light on similar inequities in neonatal care. The study, published in the Lancet Child and Adolescent Health, delves into data from every NHS neonatal unit across England and Wales, analysing outcomes for over 700,000 infants admitted between 2012 and 2022. What makes this research stand out is that it's the first in the UK to examine how socio-economic and ethnic disparities impact survival rates at every stage of pregnancy, factoring in variables like preterm births and the severity of illnesses upon admission. To put this into perspective for beginners, neonatal units are specialized hospital sections dedicated to caring for newborns who need extra medical support, think premature babies or those with serious health issues right after birth. The study's lead author, Samira Sabarian from the Health Inequalities Policy Research Group at the University of Liverpool, explained it concisely. Our analysis shows that socio-economic and ethnic inequalities independently shape survival in neonatal units, and maternal and birth factors explain only over half of the socio-economic and ethnic inequalities. In simpler terms, even when you account for things like poverty levels or health complications during pregnancy and delivery, the disparities linked to ethnicity and economic background don't fully disappear, they have their own powerful effects on outcomes. Now, here's the part most people miss. The study pinpointed some stark differences in mortality rates. Infants born to mothers in the most deprived neighborhoods faced a 63% elevated risk of death before leaving the hospital compared to those from the least deprived areas. And this heightened danger persisted even after adjusting for deprivation and other maternal or birth-related elements. When it came to ethnicity, babies of black mothers consistently showed the highest mortality rates throughout most of the study years, with an 81% increased risk of death relative to white mothers, a figure that held steady even after those same adjustments. Babies of Asian mothers weren't spared either, experiencing a 36% higher risk than their white counterparts. Crucially, the researchers found that deprivation and ethnicity operate as separate forces, one doesn't mask or explain away the other. This means a black baby from a wealthier background might still face elevated risks compared to a white baby from a similar socioeconomic group, underscoring how intertwined yet distinct these factors can be. The implications here are profound and spark heated debate. Are we looking at unintentional biases in medical care, or is this evidence of broader structural racism that influences everything from access to prenatal care to the quality of treatment received? The authors argue that policymakers and healthcare providers must take decisive steps to tackle both the root causes, like poverty and social inequalities, and the direct pathways of clinical care. For instance, enhancing socioeconomic support for expectant mothers could involve expanding access to affordable housing, nutritious food programs, and stress-reducing services during pregnancy, as these can directly improve health outcomes. Additionally, implementing culturally tailored interventions such as training for medical staff on unconscious biases or community-based outreach that respects diverse cultural needs could help reduce risks for high-risk groups. David Taylor Robinson, a professor of public health and policy at the University of Liverpool, summed it up poignantly. Our findings reveal, in stark detail, that even in 2025, too many children face significant challenges from birth, and for some, even before they are born. I hope this evidence drives real action to address the wider factors that shape health outcomes. This study challenges us to think critically. If disparities persist despite accounting for medical factors, does that mean our healthcare system is failing certain populations? Or could there be hidden variables, like genetic predispositions or environmental exposures, that we're not fully addressing? What do you think? Can policy changes alone bridge these gaps, or is cultural change within society essential? Share your thoughts in the comments. Do you agree these inequalities stem from systemic issues, or might there be other explanations? Let's start a conversation and push for the solutions that could save lives.